Let's begin here. The World Health Organization recently marked the 50th anniversary of the expanded program on immunization during African Vaccination Week. WHO says immunization has been at the forefront of its regional health efforts, saving millions of lives and transforming public health. To tell us more, we're joined by Dr Simangele Mthethwa, who is the National Professional Officer for Vaccine-preventable Disease for Africa at the WHO. Dr Mthethwa, appreciate your time. Thanks so much for coming onto the show.
Thank you very much. Good morning to you, Hugo, and to the viewers.
So let's start with the subject matter, and that is of the African Vaccination Week. Why is it so important?
The Africa Vaccination Week is something that is celebrated concurrently with the World Vaccination Week. So each of the WHO regions have their own weeks of celebration. It's actually celebrated at the end of April, the last week of April. And its importance really is to heighten or rather elevate the immunization agenda to all leadership platforms, because it being a program that has been there in existence, there are so many competing priorities that come in the health sector. So then vaccinations then tend to be left behind. So the vaccination week really is to just resensitize and heighten the issues around vaccination.
So who leads that coordination process?
So it's something that is done by all member states. So for us in South Africa, it was done, the National Department of Health was leading it, working with all stakeholders. WHO was also in the forefront, including UNICEF and other partners like those that are in the vaccination space. So basically, it's a collaborative effort, but led by the National Department of Health. That's the case for South Africa.
Dr. Mthethwa, one of the things that you're focusing on in 2024 is immunization gaps. What are those and why the focus?
Pre-COVID, the uptake of vaccines was very good. But then since the post-COVID era, like I'll say from 2021, we have seen a decrease in the number of children that are being vaccinated. There's a terminology that we use, we call it zero-dose children. So basically, those are children that have not received their first dose of vaccination. And since 2021, the numbers were around 100,000. That's for South Africa. My focus is generally in South Africa. There were about 100,000. In 2022, that went up to about 150. And now in 2023, that is last year, the number has really gone up. We're sitting at over 200,000 of children that have not received a single dose of vaccine. And we know the importance of vaccine in terms of prevention. I mean, there's a saying that says prevention is better than cure. And we've seen what vaccines have done in terms of us seeing less and less of certain diseases, and which has actually reduced the burden on the health system. So now if our children are not being vaccinated, we're going to see more and more children coming with some of these diseases that can actually be prevented easily by just vaccination. So now that is why then we need the focus to say, let's come back, let's take back our children to vaccinate, because this is very important in preserving life, in combating any outbreaks, and also just lightening the burden on the health system.
So that figure of 100,000, I mean, is a big figure, but it's doubled in 2 years. This obviously has got to be worrying for the authorities. And I'd imagine that one of the processes that you've carried out in this vaccination week is activities to try and reverse that number. What have you been able to do, or what are the conversations around how do you go from that 200,000 mark, which was where we're at now, to a lower mark, hopefully lower than the 100,000?
Yeah, so that's very true. I mean, it's concerning. It's concerning. I'm sure anyone who's listening is like, whoops, what happened there? There is a lot that has been done. We've been working very closely with the National Department of Health in terms of sensitizing the communities. The UN, not just WHO, but together with UNICEF, we've been doing community outreaches just to make sure that the community is resensitized. We've been going around educating people in terms of the importance of vaccination, and also then going to the health facilities just to also sensitize there, because now there comes the children that are actually sick, and it's important then that the hospitals are are able to review the road to health booklet to make sure that every child has a road to health booklet that is up to date, so that if a child is not vaccinated, then they are given the catch-up schedule so that they also then can catch up and be at par with their peers. So basically, there's just been a lot of sensitization. This year, there was a national commemoration of the Africa Vaccination Week. It was held in the Northwest Province, Matibeng sub-district, where we had our leaders there sensitizing the community. That is one of the communities that was seen that the numbers were actually not so good in terms of vaccine uptake. So having the activity there actually is what made more children. On the day, we saw more children coming in to actually be vaccinated.
Did you get a chance to speak to any of the mothers and find out why they hadn't vaccinated their children?
Yeah, so this is my personal interaction. Yes, so basically I think it's a lack of understanding of the importance. I think we have been silent about, we've not been making much noise because it's been a routine, it's been thought that, people just know that at 6 weeks you take your child, at 10 weeks, but I think that noise around the vaccination was kind of silencing. So I think that's one of the things that one of the mothers indicated. And also not being sure of what they will find in the facilities. Sometimes they, if they consider other things out of stock, they also think vaccines are also could be a problem. And yet there hasn't been a problem basically in the country around issues of vaccines availability.
Now, one part of your vaccination program has been HPV. Speak to us about that and what it is and what are you trying to achieve with it?
Okay, so when we talk of HPV, we're talking of the human papilloma virus vaccination. Human papilloma virus is the virus that causes cervical cancer. Basically, there's a drive globally to eradicate or rather eliminate cervical cancer. So if then we vaccinate against HPV, basically we are preventing people from actually getting the cervical cancer. Cervical cancer is quite deadly in our country. It's the first cause of cancer-related deaths in the country. Yes, it's the second most common cancer. So if now we are able to vaccinate our girls before they are even sexually active, that will prevent them from getting cervical cancer. And with that, then we will be able to see more people living better. Most of our women actually present late with cervical cancer because by the time they present, it's a silent killer because by the time it presents, more often than not, it's already late. So with the HPV vaccination, we're able to then prevent the cervical cancer.
What's the age bracket of girls or women that are immunized from the HPV?
So from the WHO recommendation, we recommend it for 9 to 14 years. However, in the South African program, it started off by girls that are doing grade 5. It started off by those that were doing grade 4, and then it went now to grade 5 so that we cover more. But there is a plan in the pipeline to cover the cohort as per the guidance.